great things to human beings. However, current outbreak COVID-19 has caused global health concerns. In this, if you see the worldwide cases, it's like 82 millions affected, 445,000 cases per day, and 1.8 million deaths. Countries most affected is USA, India, and Brazil. As a responsible citizen, we all continue to do our part of containing this pandemic by wearing masks, washing hands, regularly sanitize things around us, social distancing, lockdowns in vulnerable areas, etc. With the release of vaccine, or we started seeing the light at the end of the tunnel? Yes. To know more about this, we have a guest, Doctor Raaji Anand from Bradford, Yorkshire, UK. She is a family physician. And welcome, ma'am. How are you?
I'm good. I'm great. Thank you. Thanks for having me.
Yeah, thank you so much. So, frontline health workers, we will never stop supporting frontline health workers. They are the integral to the global response to COVID 19. In hospitals, clinics, and home around the world, health workers are taking on a significant personal risk and too often working without adequate equipment to ensure all of us can receive the care we need. The current crisis is demonstrating the essential, tireless, innovative, and too often undervalued role of health workers in ensuring a strong, resistant health systems for everyone. Yes, ma'am. People across the globe are threatened by this COVID 19 for nearly a year now. Early this month, we have got the essence as well as, but in the last week, started hearing about this new highly infectious coronavirus variant and it's spreading even faster. Please share few information about it.
Yes, as you rightly pointed out, this new mutant of COVID has caused quite a lot of panic all over the world, particularly in UK too. Though
Okay.
this virus has been identified since September, the progress nature of its transmission is what causing a lot of concern. And recently, in a meeting, in a high-level meeting, this was highlighted to the government in certain areas, particularly in London and southern parts of UK. The transmission rates has been particularly high, significantly high, almost as high as 70 to 75%,
Mhm.
and which thereby has led the government to take serious note of it, and thereby they have made sure that these regions have gone into tier 4 lockdown. And that has clearly caused a lot of significant concerns, not only within UK, and because of it globally, people are so worried that the transport media and the flights have all been kind of blocked at the moment.
Okay.
As of now, that we understand that it is causing significant transmission, but we need more clinical data to know for sure, is this going to cause more havoc?
Yeah. Yes. How about the flu outbreaks? Outbreaks are very common during winter season. Through we look for several COVID-related symptoms. How a flu infected person should react or take a necessary steps to identify and get a proper care for this flu?
Yes, it's a very relevant question because in winter months, you clearly see various viral outbreaks, particularly flu,
Mhm.
especially around November, December, and January months.
Okay.
And this, because flu as well is a respiratory pathogen,
Mhm.
the symptoms can kind of mimic each other and
Mhm.
they kind of almost sound very similar too. But
Okay.
with COVID, there are certain aspects which are slightly different, wherein a person actually experiences loss of smell,
Okay.
taste, a
Mhm.
high temperature, and a dry cough. These are the main symptoms associated with COVID 19.
Okay.
Whereas with flu, you kind of see more like cough, runny nose, and other features which then lead to productive cough as well.
Okay.
But clearly, the people need to be aware and be take necessary precautions, and thereby that is why it's very important to seek relevant testing. Now that testing is widely available, anybody who is starting with their symptoms should seek appropriate care, ensure wherever they are, they get their testing, PCR testing in UK particularly. Now we have what is called as a lateral flow rapid testing, that is the results can be available within a day, is available now. So
Uh-huh.
thereby, if individuals are concerned that they could possibly have COVID, one, they should go for testing and thereby also isolate. That is also very, very important because it's a very important public health measure, because
Okay.
thereby they make sure that it is curtailed and it's curbed and doesn't spread, especially now that we are seeing this particular variant as well. The current essential strategy that we can have to curb it is to ensure that you self isolate.
Okay, sure. Yeah, cases of reinfection of COVID-19 have been reported but are rare. In general, reinfections means a person was infected, like got sick, once recovered, and then the later became infected again. Is that even possible? That have you experienced reinfection cases in your practices?
As of now, it's more of a theoretical subject that we are seeing in papers which are published scientific data, because
Mm-hmm.
as you clearly pointed out, reinfection is when their natural immunity which they have acquired, the antibodies that they have acquired from a past infection,
Okay.
has got depleted, and thereby they then are, when they're exposed to another infection, they become vulnerable and they catch it again. And
Okay.
so far, maybe we are in early days,
Mm-hmm.
but though there have been quite rare cases of reinfection that have been cited in journals, scientific journals, and articles,
Mm-hmm.
on day to day practice, this is not something I'm coming across.
Okay, okay, that's a good thing actually. So studies in the past 6 months says almost half of these infected patients had underlying disease, particularly like cardiovascular disease, hypertension, diabetics, etc. What are the precautions should be taken by the highly vulnerable with these conditions?
Yes, we have certainly seen a very disproportionate amount of patients, particularly of the elderly age group, certain Southeast Asian descent, and certain other kind of particularly Black and ethnic minority people getting affected. And
Mm-hmm.
also the clinically vulnerable, for example, if they have underlying cardiac conditions like heart disease, or if
Okay.
they are known asthmatics, or if they are known to have diabetes, and so on. They seem to be particularly more vulnerable. And thereby, it is even more essential. These were classified as what we call it as, some of them, in fact, particularly if they've had organ transplant, if they're on in biologic treatments
Yeah.
and so on,
Yes.
they come under what is called as clinically vulnerable category, and they should be shielded. That is the best way that you can protect them, because they clearly are at most risk and to become seriously unwell if they catch the disease. And thereby, the best way to kind of protect them is that they kind of seclude themselves, ensure they do not come into contact, and they are being advised to stay at home as best as they are. Whatever jobs they do as well, jobs have been given, government has given adequate guidelines to support them, to ensure that they can work from home and so on. So
Mhm.
hopefully, with the advent of vaccine, these people can start to see a little bit more normalcy to their life. But as of now, they still need to take very serious precautions to ensure that they don't become succumb to the infection.
Okay, so when we come to expecting mothers are more vulnerable too, and we have heard about the cases where a lot of them went to for C-sections to avoid infection to baby. But please share your thoughts about it, please.
Yeah, again, as we are talking about clinically vulnerable, pregnant women are considered to be vulnerable, though thankfully that we haven't seen any significant concerns regarding pregnancy morbidity or miscarriages or early going into premature labor and so on. Still,
Mhm.
pregnancy in itself is being considered as a highly vulnerable state, particularly due to the hormonal changes and so on. And
Mhm.
thereby moms need to be again taking adequate precautions, seclude themselves, and as you rightly pointed out, nearing term, if the baby is mature and well to survive on its own, they have been advised to go for planned C-sections to ensure that they don't come to any harm.
Okay, good. So, what are the available treatment methods for COVID-19? Already you told few of those like when we start the interview, but again, people are like asking the thing like, what are the valuable treatment methods for the COVID-19?
As of now, as any other virus, we don't have any much relevant antiviral, though there have been several trials all over the world globally, particularly in UK. We've had recovery trial and so on with several arms looking at all possible strategies, all possible treatment options.
Mhm.
As of now, there are certain, we though the betterment in seeing treatments available For
Okay.
example, certain particular antivirals like remdesivir or even dexamethasone. These are all treatment protocols that have been written up and to ensure that the severity can be curbed. As of now, most of them are still in trial and tested manner. We don't have a globally agreed our kind of protocol which will say that this is what is going to be the best manageable treatment. Over times to come, surely we will see more and more. Even now that the hospital stays are being reduced because we have better treatment options, because it is not only the viral load that is causing the illness, but
Okay.
also the virus creates a hypercoagulable state and patients end up with having serious clots in their lungs, in their systemic circulation, and that in itself was causing a part of the major mortality as well. And so now that the awareness is there, patients are very early on started on medications to reduce the clots and to ensure heparin and other anticoagulable medications are given to ensure that that kind of complications doesn't occur. But
Okay.
still, there is not yet one global protocol that is available as of now.
Okay. Is this the long-term effects of this corona, like novel coronavirus? Like because you said like it will affect the lungs and the respiratory system, everything. So explain about the long-term side effects of this novel coronavirus.
And to be honest, as of early stages, people only thought that it was the mortality that was worrying. Yes, significantly, yes, there has been a significant loss of life and so on. But what is at most worrying at the moment is we are seeing a syndrome which is called as post-COVID syndrome, which
Okay.
is at most debilitating. A lot of people, even after 4, 6, 12 weeks post-infection, are still struggling to recover. There is a phenomenal amount of fatigue that they are reporting. Apart from fatigue related symptoms, there are other cluster of symptoms which seem to be very common among them. Some of them can be breathlessness or even minimal exertion.
Okay.
They are struggling to even walk a flight of stairs, do their normal day to day activity. Some of them are reporting chest pains related with exertion.
Okay.
There is something that is now termed as COVID related brain fog, wherein they are not able to concentrate, focus, they are not able to go back to their normal day to day job. And there are severe kind of anxiety related symptoms as well. A lot of people are struggling with low mood. So there is a cluster of symptoms that unfortunately which are now come together and termed as post COVID syndrome or long COVID, and which is what is significantly is going to take a huge kind of turmoil not only on the patients as such, but clearly the health professionals as well, because we need to be aware of all this and make sure that adequate kind of provisions are made to ensure we support these individuals as best as we can.
Okay, that's a beautiful answer actually. Now the FDA has approved two vaccine makers and widely available like in paces. Like we have learned about getting two different or have to take it twice. Please give more information about it.
Sure. There are two major kind of vaccine available at the moment, and one of them is called as the mRNA vaccine.
Mm-hmm.
The mRNA vaccines are being produced by Pfizer Biotech. The other one is called Modern RNA. These are the two companies which have now been given approval and are available. The first country to give approval for Pfizer vaccine was in UK.
Yeah.
So the mRNA vaccine is a novel genetic engineering coded one, and wherein the mRNA genome is injected into an individual. In fact, I'll be very happy to say that I had my first dose of Pfizer vaccine 2 weeks back, and
Okay.
I'm yet to get my second dose. So I think it's a fantastic and absolutely marvelous scientific progression that we have had within a rapid short period. So mRNA vaccine, the biggest challenge probably is because it has to be maintained at minus 70 degrees. It's not possibly probably feasible to transport to all countries, so that can cause fair amount of restriction about where it can be given and so on. But the efficacy has been quoted to be 90 to 95%, which is very, very reassuring. So
Mm-hmm.
these are the features of the mRNA vaccine. The other is called the vector vaccine. And in fact, today AstraZeneca has been given approval in UK, emergency approval in UK to be
Yeah.
rolled out from January onwards.
Mm-hmm.
And what happens with the vector vaccine? In fact, we have been using a tried and tested method. The
Okay.
current flu vaccines are based on this technique, wherein the genome of the virus is sent into an harmless virus like an adenovirus, and that is then injected into the body, that thereby produces the immunity.
Mm-hmm.
The biggest advantage is these virus vaccines, not only AstraZeneca, there
Mm-hmm.
is the Janssen, Sputnik. These are the other pharmaceutical companies who are producing the vaccine with the same methodology. And the biggest advantage is this vaccine can be stored at room temperature. And so thereby it can be transported worldwide, and thereby the impact on where we can establish herd immunity by giving to so many other countries is feasible. And another big advantage that has been cited regarding AstraZeneca is it is promoting better immunity, particularly the clinically vulnerable elderly. So the results so far that they have published shows that the elderly actually respond much better to AstraZeneca, which is even more reassuring because this is the population which we really need to protect.
Mm-hmm.
So thereby we are poised at a very beautiful stage at the moment, though we have had such a turmoil 2020. I think we are at the kind of, as you rightly pointed out, we probably are seeing some light at the end of the tunnel, and it hopefully 2021 will start to see a lot more betterment.
Okay, that was a beautiful explanation, and hope like it will be like it is very useful for each and everyone now in this pandemic situation. And thank you so much for your valuable time, and from all the way from UK. And thank you so much once again for the valuable time from Ishita Media viewers and from me. Thank you so much, ma'am.
Thank you. I'm
Yeah.
wishing you all, everybody, all across the globe, across the Atlantic, and across all over the world, a
Yeah.
happy, healthy, and that is what we are all hoping for. And hopefully, everybody will have a very happy and healthy New
Yes.
Year.
Yeah. Hope this 2021 New Year will be like the best for everyone. Thank you so
Yeah,
much.
hopeful. Thank you. Thank you.
Thank you.